Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharpe, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome everyone. It's so good to have you here today. As you can see, we have some amazing friends, colleagues, and our educational planning team here for our Gold Midwifery Online Conference 2023. And that's what we're going to be talking about and reviewing all the content today. So you're here for the right reasons. Get on board, get excited, get ready, take notes. There's going to be so much content this year, and we're excited to share with you some of the new things that we have this year for our program as well. Now, coming up, I want to share with you that this event is now in its 9th year, which is absolutely fantastic. I can't believe it that we're here already. And I want to share with you that this particular event will open on February 6th. Now, that is for our opening keynote. And the reason I want you to know about that, of course, it will be open access. You can join us on February 6th with Elizabeth Davis, and she'll be sharing on shoulder dystocia, prediction, prevention, and appropriate response. Now, this session will examine the factors that may predict shoulder dystocia, the cardial signs, and true shoulder dystocia, and most effective techniques for responding to a shoulder dystocia. Now, Elizabeth Davis is an internationally recognized expert. You may have heard of her yourself and even seen her in a presentation before, but we're absolutely delighted that she will be here with us at Gold Midwifery. Now, we'll be talking more about the content in just a moment, but I do want to introduce to you my two colleagues I have here. And so first, welcome to Fleur Bickford. Fleur has an extensive background in perinatal health and is a registered nurse and international board certified lactation consultant. Fleur's clinical experience in perinatal care as an RN working in obstetrics, combined with her professional experience with educating both families and healthcare professionals, lend themselves to a well-rounded role as Director of Educational Programming here at Gold Learning. And also my good friend and colleague, Kristin Schwarz, is here as a licensed midwife and childbirth educator and MC at Gold Learning. Kristin is passionate about educating families and an advocate for informed decision-making. Welcome, both of you. It's great to have you here today.
Thank you so much, Fiona.
Yeah, we've had a lot of fun putting this together. Okay, fun and hard work, I have to say, right? It's a lot of work to put these programs together, but each year we come together, you know, we have a fresh look. And I wouldn't be amiss without mentioning that we have a fabulous professional advisory committee here at Gold Midwifery, and they also are an integral part of putting this program together, and you can see all their faces and on our website as well. So in talking about the program, I wondered if we could maybe just jump back a little bit and talk about Elizabeth Davis. She will be our opening keynote this year, February 6th, as I mentioned. You can actually go to the website right now, goldmidwifery.com, and register for free for this event. But Kristin, I know you were the first person to put her name down on our mind map and the drawing board in terms of our keynote. Can you tell me a little bit, what inspired you to put her as, a front runner for keynotes, and finally, what came about in the decision making for her representation here?
Thank you so much, Fiona. Yes, Elizabeth Davis is so well known and loved in the midwifery community. And I remember starting out when a few years back in midwifery school, one of my mentors told me, Elizabeth Davis, get her book, Hearts and Hands. This is your Bible. And I really, really admire her passion. She has worked in midwifery for decades. She has trained many new midwives, and she's just an inspiration to me and many other midwives out there in the field. And I just recently talked to Elizabeth a little bit, and we talked about the topic shoulder dystocia, and this is an important topic, right? It's on the mind of every midwife going into a birth. And she said to me, Kristin, you won't believe this. You know how every midwife is said to be having her or his own complication, right? So, and Elizabeth said, mine is shoulder dystocia, believe it or not. And
Wow.
And so we talked a little bit about it, and in her decades of experience, she has developed, methods and ways to work with families, work with the birthing person in this situation. And she's very passionate about training other birth professionals working in the field, midwives, students, everybody there, to get the best outcome. And I'm really excited that we're having her this year to present on this important topic, and that this presentation is open access. So students and everybody there passionate about birth can learn from Elizabeth Davis.
Yeah, that's fantastic. I think that one of the questions I think that's coming up already, and maybe I'll pose this even to Fleur, is, why shoulder dystocia? Is this not something that's already well written about? Is this not something that we should already know? From the perspective of an educator, why is it important to cover this topic? If you've already taught it or you've already dealt with it, tell me a little bit about, the reasons why you want to come to this presentation.
Yeah, great question, Fiona. And yes, it is something that, midwives have already learned about, but we know there is always new research going on. There are, there's new research, there's new experiences going on, because we have to remember that the experiences of midwives in their everyday practice is actually a form of evidence that is always changing. We're learning new things as we go. But I think one of the really key things is, with shoulder dystocia being it's an emergency that can happen during birth. And it's one of those things where it's important to be prepared for. And if it's something that you learned about years ago, but you haven't really thought about it, you haven't really heard much about it, and you haven't come across it yet, when you do come across it, if it's not something that you've, been learning about recently, you run the risk of ending up in a bit of a panic because you're not sure what to do in that situation. So I think those situations, it's really important to always keep up with our education, make sure that if those emergencies happen, then we're ready to go. We know what to do to, provide for the best outcome for parent and baby. So
yeah,
really looking forward to this.
Yeah, absolutely. I think as a global talk too, I'll just say that, I'm going to invite everybody right now, everybody does have different experiences around the world. You've got different experiences in your practice, different clients, but this is an opportunity to come together, as a community and really share in some of those experiences too, with Elizabeth, with your, all your colleagues. So there can be a real growth in this when we really put our minds together and we join in the conversation. So again, inviting you to be part of this free presentation as part of our Gold Midwifery Conference. Now, I want to move into some of more of the topics. There's so many, so we want to get through as many as we can with you here today. And Kristin, I know that you have you want to share everything, such a big heart when it comes to this area. So why don't you go ahead and tell us a little bit about some of your favorite topics here? I see the first one you're wanting to share about is really midwifery-led fertility care. So tell me a little bit about that.
Yes. First of all, what I love at Gold is that we're always at the forefront of education, topics that maybe you don't necessarily learn at school or learn at other presentations, right? So I am really excited about this. Midwifery-led fertility care, a family-centered approach by Maria Goodman and Ray Racklin. And they're really passionate about educating midwives on how to provide fertility care in an out-of-hospital setting. And I think the midwifery model of care lends itself to this very well. And Ray and Maria, they will provide an introduction on how to provide culturally appropriate care to the LGBTQ plus population and transgender parents. So now we as midwives often get requests for fertility care in recent years. I have received that myself as well. And I always had to think and say, you know what, I know so very little about it. As I mentioned, it's not something we often learn in our education, especially if it's been a few years back and such. So I always felt like I had this little bit of a knowledge gap there. And there's always new things to learn, no matter how good your knowledge is, correct? So these two midwives are incredible. They are so passionate about the topic, and they really go into detail. Now, some midwives might say, oh, well, this is not really in my scope of practice, depending on where I live in the States, or, wherever country in the world. But regardless of that, I have to say is you want to have that education, the knowledge, right? So you want to be able to inform your clients, inform your families about their options, and maybe make connections in your community with other care providers that can work together and collaborate. So I think this is an excellent presentation to really educate yourself on the topic and really provide a better service for your clients. So that's why I'm really passionate about this presentation. So, and I want to hear from Fleur about this one too, real quick.
Yeah, absolutely. I agree with a lot of what you said there about we're always looking for topics that are a little bit different, things that you're not hearing about very often. And those are really the topics that we love, because it's, our goal here is really to bring that continuing education, those topics that are a little bit different, so that we can expand our knowledge and be bringing more skills to the families that we serve. So really excited about this topic and so many others. We have so many great topics.
Yes.
Really excited about them.
Yes. And I know Fiona said I have to be quick, but I know
we really could. We could spend a lot of time with you today, but we know that your time is precious too. But we'll give you a rundown and sort of an update on some of the topics. Now, speaking of expanding knowledge, we have some topics in this area as well. Prenatal environmental exposures, what midwives need to know. Kristin, just tell us a little bit about that one.
Yeah, and you can imagine, again, it's a topic we don't talk much about. We have not had much information, but we know, we're looking at our environment, and off camera, we chatted a little bit about also what's going on in the world from, fires and other disasters there. So, and, we know there's a lot of chemicals in our food and water and such. So that, of course, becomes a concern also to the pregnant population, and us as birth workers and midwives, how can we counsel our families? Now, this is a very, if you look at the topic, perinatal environmental exposures, what midwives need to know, by Tanya Kemet-Taiwo. Tanya is very passionate about this topic, and a delightful and knowledgeable midwife. She's absolutely incredible. Yes, it's a heavy topic, but you will leave this presentation feeling uplifted and ready to go and know something you can provide and do. So despite being a heavy topic, you really, really will feel you have learned so much coming out of that presentation. So I can't wait for our viewers to join us for that presentation. And also the presentation about caring for clients with disabilities in the perinatal period. Also so very, very important, right? And again, coming back to that midwifery model of care, what other model of care is better suited to provide services to the population with disabilities, right? I mean,
I think that's going to be a really important topic, because I feel like it's an underserved area still to this day. So and you're right, what better community to talk about it and share about it and help us understand what we can do better.
Yes, absolutely.
I just want to comment that, with that particular topic, I'm really excited about that, because as the parent of a fairly newly disabled child, it's been really eye-opening. And, I've had my own sort of, ingrained ableism pointed out to me a few times by my son, which I really appreciate, because it's such a great opportunity for growth and learning. And if those things, we're not talking about those things, we're not learning, where, do we have some of those biases? It's, we're not serving our clients in the best way that we possibly can. And I find, rather than it being like, oh my goodness, like, yep, this is another heavy topic that we don't really want to talk about. These topics, once you get into them, it's such a great feeling to have that, professional growth, to be able to serve your clients better. and just really interesting, once you dive into some of these topics. So really excited about that.
Absolutely.
That's awesome.
Absolutely,
That's
Fleur.
awesome.
And I want to end this about this topic here with a quote by Dr. Leslie Tarasoff, who is, of course, the presenter here for this presentation. And Dr. Tarasoff is saying, fragmented care, unmet physical accessibility, and communication needs and negative provider attitudes may have significant health implications in the perinatal period for women with disabilities. So definitely a topic that's underserved and we haven't, talked about enough. So I hope everybody is excited to learn from Dr. Tarasoff there.
Yeah, absolutely. One of the other really important areas of conversation that we actually have right across the board here at Gold Learning is collaborative care.
Mm-hmm.
And of course, we wanted to include it. It's a really important part of midwifery, care. And I know that many communities are collaborating with other professionals. Let's just highlight a couple of the ones that we have here at Gold Midwifery this year. Kristin, would you tell me a little bit about Andrew Dara, please?
Yeah, Andrew Dara is back by popular demand. We had him speak once at Gold, and he's such an engaging speaker, so we definitely want to have him back. And he will be presenting on utilizing the Webster technique. Again, it's a topic many midwives may be familiar with, right?
Mm-hmm.
But there's also a lot of myths involved. What is the Webster technique exactly? Some people say, oh, it's just for turning babies. Oh, we don't need this. Or, chiropractic care, it might be also misunderstood in the perinatal period. So he is there to bust myths and explain exactly what the Webster technique is and show us also with videos he has specifically filmed just for us here at Gold to show and exactly walk through step by step what he's looking for, what he's actually doing. So yes, as midwives, we're not performing that obviously ourselves. But we're collaborating with, care providers like chiropractors. So, but we should be able to explain to our clients what exactly is happening there, So we're referring them, we're saying, okay, yeah, go see the chiropractor. It's going to be good for you during the pregnancy here. But how good are we really equipped answering questions if a client comes and say, okay, well, I'm a little nervous. What is he or she doing? What is this going to harm my baby? What's happening here? So this will give us confidence to know exactly what chiropractic care is provided in the Webster technique. And he's showing us step by step. So it's a fantastic tool. It's like you're sitting with him in his, in his practice and watching him, give the service to the client in front of us. So it's fantastic. It's just being like they're shadowing him. I really enjoy this.
That'll be really good. That'll be really good. I was going to say, Fleur and I had a conversation about this because we had all the same questions when, when this came in, talking about, the Webster technique and what really did we need to know? It was that conversation of, is there more? Could there be added to it? But I remember when we started looking at the abstract, and then we had an opportunity, of course, to talk to Dr. Dara about it. And he really kind of laid it out. We're like, oh, there's a lot. And I'm excited, I'm really excited to know all those things, because I think for the longest time, it's just been, oh yeah, get the Webster technique and, it will make things better. But he's really going to dive into all the really critical details so that we can actually, provide the resources to our families and then, work even better with our specialists in the community.
Right. Absolutely.
Yeah, that's going to be great. Kristin, why don't you jump on to talking a little bit about the acupressure with Loredana Zordan.
Absolutely. Yeah. Loredana Zordan is a midwife and also an acupuncturist. And Loredana is teaching a specific method of acupressure. And she has done so for many years and even educated birth workers and nurses and midwives in a hospital in the UK. And they have implemented that into their protocol now, which I think is fantastic, right? To have that at a hospital, to have that kind of for pain relief and stress relief and such. So Loredana will show us exact pressure points that we could utilize in labor to, ease pain and increase relaxation and all the good stuff to get all these beautiful endorphins going during labor and birth there as well. And again, some midwives might say, depending on where they live, it's like, oh, isn't that out of scope of practice? I know for myself here in the state of Florida, only a a body worker or somebody trained as an acupuncturist, a licensed acupuncturist is allowed to do that. However, here is the big part, is teaching this to our clients doing it themselves, or have the partner perform this on the birthing person, right?
Yeah,
that's priceless, because yes, you're a team and you give them the confidence, another tool in their toolbox during labor to, as a labor coping skill, or even during pregnancy to ease for relaxation and such. So I always love when there's tools for our families that they can use themselves, because that really increases their confidence in themselves and feel like they're they're in charge of their own birth, right? So that gives them another tool for their toolbox.
Yeah, absolutely. I'm really looking forward to this topic. This is something I really am interested in. I was able to also do some training in acupressure as well, and actually worked with the same educator that Loredana did. So, we had a lot to share on that topic. So I'm excited about that.
Yes.
Okay, let's get into some of the new things this year and highlight those, because this is going to be very specific. Let's describe the topic first for folks listening in, and then we'll get into what tools are available, because this is the key thing. So listen up right now. This is going to be an important part of the conference this year, where you can actually come in pre-conference and get some education. So listen carefully as we go through this particular topic. Let's dive into the speaker and the topic first. Who would like to take this one?
This is about the interactive session, right, Fiona?
Yes,
this is
correct.
absolutely perfect. Yes, it is about decision making and psychiatric medications in pregnancy and lactation by Rebecca Feldman. And Rebecca is a midwife and psychiatric nurse practitioner who practices in a dual role in this field. And I had a little chat with Rebecca, and I asked her, how did you come to this dual role? And she explained to me that when she was starting out as a midwife and looked for other providers in this field, she couldn't find that many. So she decided, you know what, I'll become also a psychiatric nurse and be able to be better there for my the families I serve. And she works in she created this beautiful center in New York City. She works with other nurse practitioners and midwives, and also with also good focus on the LGBTQ plus community. And she just does amazing work there. And going back now to this interactive session. So Rebecca will give us case studies, and we will have some of that beforehand on the website, so people can really prepare themselves. And it's really like an actual case, and she walks you through, and she will ask you questions. And so how you would, as somebody providing care, would handle the situation, or counsel their clients. And I think this is a way to learn. It's, for me, a way to learn really, really well, right, Fiona and Fleur? I don't know about you guys, but it's absolutely fantastic to have that where you feel like you're part of the solution, you're part of thinking, and then also learning from other participants in the room, because we, as you mentioned, Fiona, earlier on, we all come from different countries and backgrounds and different professions in the field, learning from each other and seeing how, what other suggestions others bring into the mix here for that particular case.
Yeah, absolutely. So again, just to be clear, you can go to the website, register today at goldmidwifery.com. When you register, you'll be able to go to our participants dashboard. You will see all the different pods there, and that will include the interactive session with Rebecca Feldman. And you'll be able to click on there and get some pre-work in. There's a beautiful case study there. You can work through it, bring the results in. Rebecca will be talking about them during the session, plus there'll be additional case studies. And I think, again, Fleur, you and I have talked a lot about case studies over the year, trying to figure out how we would bring them into programming here. But they really have become, one of the things that drives a lot of our education today. People thrive on case studies. Why do you think that is?
Well, one of the reasons why we've, started bringing these different types of interactive sessions in is because it allows for a different type of learning. And there's, when you're sitting and just sort of passively listening to something, you're not necessarily really taking it all in. So
Right.
I think what a lot of people really love about these sessions, particularly the case studies, is it forces you to go through that like piece of critical thinking. What would I do in this situation? And for one thing, it's interesting. It's interesting to, think through that and go, okay, yeah, have I come across this before? What would I do in this situation? Do I have any knowledge gaps? Is there something that I'm not sure about that, I need to go and learn a little bit more about? And I think that provides a different depth of learning. And I think when people learn it that way, you remember it better.
Yeah, I think so
that's
too.
the type of thing that really
Real
sticks
life.
with you.
Yeah. Things come to life when you go through these case studies, and I think we can all kind of imagine ourselves there. I know for me too, as a learner, it's become very valuable to hear a lot of these case studies, scenario-based learning, I really thrive on. So I hope you do too. I hope that you enjoy them as much as we do here at Gold. All right, let's talk about some more of the sort of elements that we have here. Fleur, I know you wanted to talk a little bit about the panel that we have coming up here at Gold Midwifery.
Yeah, absolutely. So our panel is another one of our interactive components to the conference. We're working hard to bring in as many of those interactive components as we can. And the panels are always so much fun because there is a lot of interaction. So with our panels, we have 3 speakers joining us from different parts of the world, and we're going to be talking about tips, tricks, and things to think about when labor is prolonged. So common situation, and one of those situations can be quite tricky because there's so many different layers to it. And there's, what's going on with the birthing parent, what's going on with the baby, what is going on physiologically, what's happening psychologically, what are those impacts during actual labor and delivery, what are the impacts postpartum. So many different things to think about, which makes it really interesting. And having speakers joining us from different parts of the world, they're bringing different perspectives. And then one of the things I love about these panels is the interaction that happens within the chat. So Kristin, you mentioned that just a minute ago about the learning from one another. So I love watching the chats during our live sessions, not just in the panel, but all of our sessions when they're, during that live component, when our attendees are talking to one another, they're sharing their experiences. There's a lot of resource sharing that happens in the chats, which is great. So a lot of times people are finding resources that they didn't know about, resources from other parts of the world. So really great opportunity for you to, join in the panel, share your own experiences, tell us what you have found works. And that's one of the really exciting things, is just that learning from one another, along with learning from our panelists, of course.
Yeah,
So,
absolutely. Yeah, no, that's going to be really good. I can't wait. That perspective from around the world, is always so valuable, because it can bring in things that, may not have thought of, in different areas. So that's going to be great. A couple of other cool things, fun things, and dynamic things for you to think about and come and join and be part of. We love building community here, of course, at Gold Midwifery. And so we have a yoga session again for you this year. So we hope that you'll be part of that. You can come and stretch, have a moment. This is really about self-care as well. And we want you to take advantage of these sessions. So we have a yoga session for you, but we also have a mindfulness session as well. And I'm excited that Anna LaGrange will be here hosting that session. So these sessions, again, are meant to be a give back to you. They will give you a bit of time out time to collect your thoughts, be present, all the things that we often don't take time for in our busy lives.
Right.
So
Yeah.
once again, do join us for those sessions. They'll be on your dashboard when you register for the event at goldmidwifery.com. And we're truly excited to see you be part of those as well. So stay tuned for more on that, but you'll be able to register online. All conferences, we have a closing keynote as well. And I'm absolutely delighted to say that we have Toni Harmon with us this year. She's going to be with us live on February 27th. Now, again, with being a keynote, it means it's open access. So for those of you listening in right now, you'll be able to come and listen to Toni Harmon for free, and you'll be able to register your seat today at goldmidwifery.com. You can head over to the website right now and register for this free live event. It will be February 27th, and the topic will be Turn the Microscope on Birth, the Microbiome, and Midwifery. Now, many of us are very familiar with the microbiome, but do you know how it's impacting birth and beyond? And that's really the key to this presentation. Toni Harmon is a producer and director of the very popular Microbirth movie, and we'll be looking at the science and the microbiome and how it applies to the midwifery profession. Again, really taking things to a whole new level in your profession and giving you an opportunity to teach on this amazing topic. It is big, and so of course we really wanted to highlight her as part of this conference and event. And so it will be a 95-hour presentation with an opportunity to come in live and offer questions to Toni, and we'll have a closing Q&A with her as well as part of this presentation. So I think that rounds it out. I mean, so many things to consider here. We're very excited to, of course, present this to you. We'll look forward to seeing many of you on February 6th. Remember that this event will be recorded as well, so you'll have access to it at your convenience, which is just a wonderful opportunity. Kristin, Fleur, any closing words before we head out today?
Go ahead,
Just want
Fleur.
to say, make sure that you go and sign up for the keynotes now, because that way you will get the email reminders so that you don't forget. And as Fiona mentioned, if you can't attend live, you will have access to the recording. Same with all of our presentations, but just really looking forward to seeing everybody online and having you as part of the GOLD community.
Yeah, absolutely.
And I would like to add, this conference is not only for midwives, although I mentioned midwives a lot and when I talked about the topics, but anybody really in the field as a birth worker, as a lactation consultant, a doula. You know how important pregnancy and birth is also in the postpartum period. So anybody who is really in the field, you don't have to be a midwife. You can be working as a labor and delivery nurse, or as I mentioned, IBCLC doula and such. I think it entails so much valuable information that anybody really can benefit from this conference. And I'm really excited about it and looking forward to seeing everybody online.
Yeah, thank you so much to both of you. Thank you to Fleur and Kristin for joining me here today. And of course, to all of you, don't forget to come and enjoy this event this year, starting on February 6th. You can come and listen into the latest research from our amazing speakers. We have 15 expert speakers this year, over 15 hours in our main conference with over 24 hours on our add-on conference. It's endless. You'll be able to come and enjoy all the events, of course, as part of the registration here at GOLD Midwifery. Come and join us. It'll be a wonderful opportunity, and I can't wait to see you there. goldmidwifery.com. You can register now, as we said, for all of the up and coming opportunities. Thank you again, everyone, and have a wonderful rest of your day. Bye-bye for now.